Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have no announcements this evening, additions or deletions to the agenda. We are going to make one change and move D under new business, discuss vote to continue waiving fees for metal disposal under reports and staff initiatives. Seeing as Clint is here. Appointments this evening, we have a presentation from Southern Maine Medical Center and Goodall on the merger of the two operations. So welcome if you'd like to come and introduce yourselves. And yes.
Oh, okay. I'm Patsy Abel. I'm the president and CEO of Goodall Hospital, and on January 1st I will be the chief operating officer of Southern Maine Healthcare, the merged entity.
I'm Ed McGeach. I'm currently president of Southern Maine Medical Center and will be the president of Southern Maine Healthcare when we merge on January 1st of 2015.
Yeah, the Selectmen's meeting's on the Hager.
We are.
All right, so what we're going to do is show you a brief video on the two institutions, and then we have a PowerPoint that we'll walk through.
Okay.
Yep.
With that, Kristen's going to put on the video.
Only problem, Patsy, we don't have a mic that's working.
20th century, SMMC.
Hello?
Everything's on except on that Emerson monitor, it's not showing the meeting.
It was a short video.
No, I hear what's on the TV monitor.
Which is operated by Goodall.
Very technical difficulties all over the place tonight, huh? The gremlins are out.
Okay, so what do I do? It's all lit up, all the lights are on. Three on the right, or I split up.
Compassion, accountability, respect, and emphasis. With shared
All right, let's skip the video.
Let's get the video. Those are all on.
It was a very nice video.
I'm sure.
All right, so I'm going to do the first few slides, and then Ed's going to do the last two, and then
One
we'll
set
just
of headphones
open it
is
up for
the show
questions.
that's playing
All right.
on Emerson
And
monitor.
so Southern Maine Healthcare, that will be the name of the new organization as of January 1st. We've been caring for people in Waterboro. Goodall Hospital has been caring for people in Waterboro for over 85 years. We have made a commitment, as you know, to this community. We've been at 10 Goodall Drive in Waterboro for several years now. And on January 1st, the two hospitals are coming together, and the both of us will be changing our names. We are actually merging the two organizations. So Goodall Hospital and Southern Maine Medical Center, our signs come down at the very beginning of January, and the new signs go up for Southern Maine Healthcare. You'll see underneath our name that Maine Health is under Southern Maine Healthcare. Actually, Maine Health is a parent company. It has 7 hospitals under it, including Maine Medical Center. And again, we are already merged with Maine Health, and now the two hospitals are coming together. When we began our journey, it's been over a year now, and when we began our journey to merge between Goodall Hospital and Southern Maine Medical Center, what we did was bring our Board of Trustees together. And the way we did that is we took 10 members from Southern Maine Medical Center and then 10 members from Goodall Hospital. And in addition to that, we changed the makeup of the board so that our board is now made up of almost half of the members, 8 of the members are actually physicians. And one of those members is actually Dr. Frank Goodall, who's currently here in Waterboro. We brought the community together and we actually asked for input in terms of what the new organization will look like. So So we came together and asked for their input for the mission, the vision, and the values of Southern Maine Healthcare. And this is the mission statement that we've come up with. Southern Maine Healthcare exists to improve the health and the healthcare of the communities we serve. And for years, hospitals have been taking care of the sick. And now not only do we take care of the sick, but as you know, we also work furiously on wellness, keeping people well. And with that, I'm going to turn it over to Ed.
Mr. Patsy. Good evening. Thanks for having us here tonight. I'm very appreciative of this opportunity. So Southern Maine Healthcare is a substantial healthcare organization in the state of Maine. We are, the Southern Maine Medical Center currently is the 5th largest of the hospitals in the state, and we will very definitely be in that top tier of the top 5 hospitals or local healthcare systems when we come together as Southern Maine Healthcare. We operate 46 locations in York County, including the facility that Patsy spoke to you about here in Waterboro. We have an annual budget that's about a quarter of $1 billion. We pay folks who work for us about $122 million a year, and we purchase $76 million in goods and services, much of it locally, but not all of that locally, of course. A lot of what we buy has to be bought from even outside the state of Maine. The largest employer based in York County. We have approximately 2,200 employees who work with us. 50 of those employees live in Waterboro, and we have about 25 employees working in Waterboro at the facility that Patsy mentioned earlier. We also have within that facility 11 physicians and providers, including Express Care, which is a walk-in. It's one of our 2 walk-in centers within the system. Family medicine, orthopedics, and therapy services all in that building in Waterboro. We occupy about 25,000 or so square feet in that building. So we're a substantial building, which is fairly new, as you know, and we're very proud of it and are pleased to continue to offer those services and to grow those services, frankly, in the town of Waterboro. 2 organizations are merging to sustain the best of healthcare for Greater York County. But we're also doing it, frankly, to provide care more cost efficiently. Healthcare, as we all know, is very expensive for all of us. In fact, the cost of healthcare in the United States is something about which the federal government is very concerned and has embarked on Obamacare and other initiatives to control the cost of healthcare within the United States. It's simply not sustainable. As we move forward as 2 organizations, it of course creates questions within the communities that we serve about what exactly they might lose. Folks, when they see change, often think the worst, and in this case, we've anticipated that people who reside in the area that we serve would wonder whether services will be changed within the communities they live in. The reality of life is that there will be change, but we also felt that we needed to really reassure both the Biddeford and Sanford, Waterboro, Kennebunks of the services that would be available at the 2 flagship hospitals of our system, as well as elsewhere within the area. So with the blessing of the Board of Directors, the Board of Trustees that Patsy described earlier, we're offering the following assurances to the communities that we serve. That we're going to have 2 full-service hospitals, one in Biddeford and one in Sanford. Those hospitals will have 24-hour-a-day, 7-day-a-week, 365-day-a-year emergency departments. We'll perform surgery at both hospitals. We will expand access to primary care, so that's family practitioners, internal medicine, pediatricians, folks who people see on a regular basis for their healthcare problems. as needed in our communities, and that includes Waterboro, of course. That we will expand access to specialists, and specialists are typically available, around hospitals, surgeons, cardiologists, and that sort of thing. In particular, we'll be expanding access to specialists such as cardiologists, pulmonologists in the Sanford area. Have an integrated medical record that won't be available when we merge on January 1st, but by March 1st, all of the medical records from within that Southern Maine healthcare system, the two hospital system, will be integrated. So you'll be able to get information in Waterboro from tests that have been done in Sanford and Biddeford and that sort of thing. We'll be investing in up-to-date facilities, technology, and equipment, and frankly, Waterboro has one of the newer facilities in our system. Kenny Bun's in pretty good shape. But Patsy, if she was standing here, would tell you that Goodall's had difficulty maintaining the facilities in Sanford, so we'll be in particular investing in facilities in the Sanford area. We'll be investing in up-to-date technology and equipment as well. Same thing, in the Sanford area, difficulty maintaining up-to-date equipment for financial reasons that are unique to a hospital the size of Goodall, and we'll be fixing some of that. The Sanford community in particular relies on Goodall for elder care services. Goodall, if we had been able to show the video earlier, the video talks about the elder care services at Goodall, and the community of Sanford's very reliant upon those services, and so we've pledged that for the foreseeable future, which we define as 3 to 5 years, we'll be operating elder care facilities in the Sanford area, and even perhaps expanding that. And very importantly, again, particularly in the Sanford area, expanding mental health services, something that's been in short supply in the Sanford area. Now, we talk about a 3 to 5 year planning horizon and those assurances that I just talked about. The reason that we can't look too far into the future is because we realize that healthcare is very expensive. We realize that the federal, state government, private insurers are wanting to make a lot of changes, and that we can't continue to spend as we are now on healthcare services. I've just put on this slide, or we've just put on this slide, some examples of some of the challenges that we face as we plan for services in our communities. Just in our fiscal year that began on October 1st of this year, we've encountered a $1.5 million reduction in our payments from Medicare as a result of sequestration. And you've all heard of sequestration, federal services closing and that sort of thing. Well, it's also impacted those of us who take care of Medicare patients. So the hit from that, just providing the same level of services, same number of services, $1.5 million. The state also has cut our payments on patient services by $1.6 million. Again, the same volume of services, same type of services, got paid $1.6 million last year as opposed to this year. And the state taxes hospitals to leverage additional money from the federal government. They increased our tax by $1 million. The sum of those is $4.1 million, and so we've been dealing with that issue in our budget this year. And it's the reason that as we look out into the future that we have to be very careful about the assurances that we can give people about the services that we're going to be able to maintain going out into the future. We also, as a result of the economy and as a result of changes in the way healthcare insurance is provided, in some cases not provided, have seen huge increases in free care. Free care is what we call the care that we provided on a sliding scale to people who just can't afford the care that we provide and are uninsured for the most part. Bad debts are money that folks theoretically should be able to pay for their care who simply don't. 2 years ago, that number that you see there, $33 million in money that's not paid to us by individuals, was $22 million. So in 2 years, that's grown by $10 million. Very challenging for us. One of the ways that we're dealing with that is that we are both, or that Southern Maine Healthcare is part of the Maine health system, the largest system in the state of Maine. Maine Maine Medical Center is the flagship and our sister organization of that system. And we're able to leverage the size of that system to provide benefits from shared staffing and shared purchasing. Another way that we're dealing with it, though, is that we are consolidating some services. A simple example of that, and one that we had intended to do all along, was to take a service like sleep studies. Those are studies that are provided to people who have sleep disorders. We were doing that in 2 locations, one across the street from Southern Maine Medical Center and then one in Kennebunk, which Goodall was operating. As a result of a change in ownership of the hotel, we had our sleep lab in. We were required, along with Mass General down in Massachusetts, by, I think it's Comfort Suites, that took over the building. So they kicked Mass General and us out of our sleep labs. So we decided that was an optimal time to consolidate with the lab in Kennebunk. And so we saved rent, and we had some economies from some improved staffing when we consolidated those 2 labs into Kennebunk. But more dramatically, as we approached the merger, we realized that we really did need to achieve some other economies. And in other presentations that we're doing in other settings, Patsy would describe a $4 million budget hole that Goodall has in the current year. And so we need to address that, and we've been trying to do it in a way that is minimally intrusive into the community. So one of the changes that we've made is that we'll be only delivering babies at the Biddeford campus. Goodall was delivering about one baby every few days, and they had a low volume. Now, that's not atypical. Southern Maine Medical Center was only delivering a couple of babies on average every day. So we're able to deliver all of the babies from both of our campuses in Biddeford without expanding staffing or facilities. And that change, the staffing and other demands on our financial resources, it's enabled us to save $2.1 million per year just in operating expenses. And as well, we would have had to renovate the Goodall birthing suite, which we believe would have cost us an additional $3 million in an outlay of just cash. So we're doing things like that. We have some other things in mind, and again, we're trying to do things that affect as few people as possible as we do that, but we'll be doing more of that. So when I say that we would have had to renovate the Goodall birthing suite, it was a suite, an area of the hospital that did need some attention. Southern Maine Medical Center was fortunate to be able to do that a while ago, and so we are giving you a picture here of a birthing suite or a room in the Southern Maine Medical Center birthing area that Patsy were doing as part of the presentation, as we do sometimes. She would call that lovely. It's not a word that I use, so it is quite lovely. So Southern Maine Healthcare's future role in Waterboro, I've always mentioned that we love the facility that we have here. We think that we've got a good set of services that we're providing, and we intend to continue to do that. So we will partner with you to improve the health and healthcare of the Waterboro community. But I say that we are as an organization, and this is part of the mission of Southern Maine Healthcare. It's also part of the mission of Maine Health. We're not only here to provide care to people when they're sick, but we're also here really focused on trying to keep people healthier. That's a difference in the mission of hospitals that's really occurred over the last 5 or so years. So we're every bit as attentive to keeping people healthy as we are to just making sure that we're there when people are sick. So again, I probably would have skipped the rest of this slide had we been able to show the video, but we both of our organizations, Goodall and Southern Maine Medical Center, provide excellent care to our patients. We are accredited. We have the gold standard accreditation of hospitals in the United States. A lot of hospitals have given up on this because the standards are so demanding, but we are accredited by that organization, the Joint Commission, both rated A for safety by the National Leapfrog Organization, recent unfortunately the most hospitals in the United States that are given an A for patient safety. We have a breast care center of excellence at Southern Maine Medical Center, Pathways to Excellence nursing recognition. We're the first in Maine to get that, again, at Southern Maine Medical Center. Have joint replacement programs that are nationally accredited at both hospitals. And we have a cancer care program at both hospitals that's nationally accredited as well. So we're really very, very proud of the quality of care that we provide, and we intend to do that. This last slide here. Goodall's been around for 85 years. Southern Maine Medical Center has been around for well over 100 years. We intend to be here for at least another 85 years, providing care in Waterboro and throughout York County. We will do that with a degree of excellence that we are confident the community will be very satisfied with. So that's our presentation. And thank you for having us. Does anybody have any questions?
So other than the name change, what are people going to start seeing first for changes that are going to mostly impact Waterboro residents?
I don't think, with the, we actually are coming, Sue and Patsy and I are just coming from a management team retreat. We got our new management team together, and we're talking about what happens on January 1st when we merge. And as a practical matter, you're not going to see much different. You're going to see a new name on the sign outside of the building. It'll be Southern Maine Healthcare, not Goodall. The staff will have Southern Maine Healthcare name badges, but that's about it. I think it's going to be very transparent to the community. You sure can. Absolutely.
In Sanford, obviously closer to Waterboro, we have expanded access to cardiology services, so we've added hours of cardiologists that are now visiting the campus, adding pulmonologist hours, we've already done that, and hopefully in the future we'll be able to add dermatology also. That'll take some time, but we're working on that. And then we talked about the electronic medical record, and as that becomes integrated, again, that will be around the March timeframe, but what that means is that we'll have one medical record for every patient, no matter where they come within any of those 46 locations. So if a patient is seen in Sanford and later seen in Biddeford, or seen here in Waterboro and then is seen in Biddeford or in Sanford, that one medical record will be able to be seen by the physicians. And really what that should help do is cut down on duplication of testing, and it will really be for the patient benefit.
What about any changes that we'll be seeing at the campus in the future for that's here in Waterboro? Are you looking at expanding, having more physician services or different services available there? Do you have, what's the growth potential there?
Right now, honestly, we're happy with what we have right now, and not planning on growing it at this point. Again, we're kind of getting our feet wet with all the merger activities, and I'm sure we'll get to it, but not right. We haven't discussed anything further at this point for this campus. Is that fair? Yeah.
John?
Go ahead, John.
I volunteered as an EMT. Concern that we have, or I have, is that we may be servicing a few people that have a lot of needs. And a lot of the times that those calls come in, they don't need to go to a hospital. There may be some psychiatric stuff there. There could be a combination of physical and psychiatric. But every time you think a person gets into an ambulance, and all they have to do is say, I want to go to the hospital, you're talking $400 to $700 just to get there. Then as soon as they get to the hospital, there's a tremendous cost also. Is there some services that, and where would it be at the hospital level that these services might be, or would it be someplace else where some of these people can get social work, some lower level medical services at home And if they're making calls every 2 weeks and they're getting 20, 25 rides a year, and multiply that times $700, and then the cost in the hospital, if you can cut that down to 4 or 5 rides, and provide the services in the home, boy, are you looking at those services?
We're gonna be doing things on 3 different fronts, so let me start with the first one. The first one is that, and I neglected to say this when we talked about expansion of services in the Sanford campus. Again, psychiatric care is an expertise that the Biddeford campus has, and currently Goodall does not have, or the Sanford campus does not have. So we will be expanding psychiatric services in the Goodall campus, and we're gonna start with telepsychiatry. So that will be a beginning of our journey to increase access to behavioral health services in Sanford. So that's one piece. And then our journey will continue through the years, but that's where we're going to start. When it comes to the physician practices, what you will see, and again, this will take us some time to get there, but what you will see is that we are changing the makeup of our physician practices, and that with time you will see that we will have a social worker in the physician practices, and probably nursing in our physician practices. Again, this is with time. With the whole point that we are forming what's referred to as patient-centered medical care, and that social services in part will be able to kind of help the patient navigate and help decrease the long-term needs of that patient by helping to coordinate amongst all the physician services that an individual patient has for needs. Did you have more, Ed?
Yeah, I can add, you said there were 2 things, did you have something else?
I think it was nursing, and I forgot, as soon as I said it.
So the other thing that really, Patsy just answered beautifully on 2 of the things that we're doing. I would say that Waterboro is fortunate to have a walk-in clinic here, because that service is intended really to cut down on unnecessary transfers to particularly emergency departments. You know, folks should be using that as an alternative for the lower end kind of things that they would ordinarily go to an emergency department about. But very importantly, the patient-centered medical homes will also have the services primarily provided through Maine Health, and that's case management. And so most people use healthcare services pretty reasonably. You know, there are folks, as I think you were pointing out, that can go to the hospital, go to the emergency department 20, 30, 35 times. I think the main care record is something like 65 times in a year. You know, with all of the costs that you've talked about, including calling the ambulance, you know, when they need to go. So Maine Health has case managers who take a look at those high utilizers and work with them with the kinds of services that you mentioned. They'll go out to the homes, they'll try and work with those folks to decrease their dependence on the healthcare system and hook them up with services.
I just see in some cases a call once or twice a week, a visit once a week, and that in some cases that may announce a prevention, you know.
Exactly, yeah, and that's kind of the philosophy or the objective of the programs that Patsy was talking about, and the one that I just mentioned as well.
David?
Yeah, on this, the free care cost, is this Obamacare or gonna help that at all in the future?
Do you want to tackle that? Or do you want me to?
It's okay to say we
Patsy's
don't
gonna
know.
let me answer an unanswerable question. So, the intent is, the intent of Obamacare, and who knows what's gonna happen with Obamacare, I don't know. But the intent would be to cut down on that. The result would be that more people would be insured, and therefore that you'd have less of the free care and the bad debt.
Yeah, which would be a huge,
Yeah, so
benefit.
folks gotta be able to sign up for it, number one, and you know, all of the things that we know are problematic about it.
And what we struggle with as an unknown is that there, you know, a lot of the programs that are out there have very high deductibles. And so what we find already is that a large percentage of our free care or bad debt is due to the high deductible that people can't afford.
Yeah.
So by putting people on Obamacare, again, it's unknown, you know, whether it's gonna help or not, but that's certainly the intent.
Hmm.
So when Obamacare was sold to hospitals, we were told that Medicare was gonna pay us a significant amount less over the next 10 years as our contribution to supporting that increased access to insurance that people in the United States would have. And so the way we justified it, the way the hospital industry justified it is just what you're suggesting or what you're asking, and that is that more people would be insured, therefore we'd have less bad debt, therefore we could afford to get paid less by Medicare. And so really, what we're worried about and wondering about right now is whether that
Works.
reduction that we agreed to is really gonna hurt, because we're just not gonna have the people on the program.
Now, have you seen with the Waterboro facility, more people from Northern York County coming for, as patients, services, like Limerick or
We see, I wouldn't
Cornish?
say more.
No?
Clearly, I'd still say the Waterboro and Sanford and Springdale community are the highest utilizers of the walk-in care, but certainly we have people from Acton and Chapley and Buxton, but the numbers are much lower
Yeah.
than perhaps we would have anticipated when we opened it.
Yeah. I'd like to praise you, I guess it's not the right word, but your sleep study program is excellent. And I never can think of the doctor's name. Namalal Guru. She is so excellent. She's excellent. She's just amazing.
We'll make sure we pass that along to her.
Yeah, she has a great ability to zone in and look at a lot of different areas, not just the sleep study, but she is a very well-educated person.
Dennis?
Almost, sir?
Gordon?
What is the value of having in-house pharmacies, like they're at the walk-in clinic down here and the one in Sanford, when the availability of private, Sanford alone has got, Rite Aid and CVS and,
Well, Goodall Hospital, actually, we used to have a June Street pharmacy in our medical office building, and it was the hospital's pharmacy, its own retail pharmacy. It was purely built for ease of patient access. And you're right, there's just too much competition in that marketplace, and if the truth be known, unless you sell beer and cigarettes, you can't really break even in the business. And so we did close that. The business here in this, the Waterboro facility, is a retail independently owned by a woman named Angela McGarrigle. It's called Good For All, and it is independent. But again, it's a perfect fit. It's, healthcare related, in with hospital-related services and ease of access.
so that doesn't impact your bottom line and your staffing costs and operating costs then?
Correct. No, yeah, we don't own it. It's
Okay.
private.
In fact, you probably receive some revenue from that, don't you, the rental space?
Exactly,
Oh.
yes. Yeah.
Anything else?
Thank you again for your time.
Thank you very much for
Thank
taking
you.
the
Thank
time
you.
to come in.
Apologize for the technical difficulties.
That's fine.
Okay, moving on, hearing a delegation. Correspondence this week, we have the Treasurer's Report, Representative Libby newsletters, Senator Tuttle's legislative updates, the Assessor Agent December calendar, Saco River Community Television 2014-15 budget information. And Jerry? We're ready for Jerry.
Thank you.
So we have reports and staff initiatives, and we have the Assessors Agent to discuss vote on the Babb abatement appeal. And here he is.
Thank you.
Good evening, Jerry.
Good evening, board members. Chairman Durant. We should have just one item tonight. Continuance of the Babb abatement appeal. You should have the abatement request. After reviewing and correcting and updating the last report that you had. It appears that when you look at the study, the indicated values using both methods seem to indicate that the property, when compared to the others, has a overvaluation, if you want to call it that. Therefore, I am recommending that the board consider granting an abatement to make the adjustment on the Babb property. That would be abatement number 1455. And due to inconsistencies, it appears that the property has been overvalued, and therefore the recommendation is to grant an abatement of $416.02. This would bring the valuation of the property, land only, from $218,200 to $187,700. And with that, I'll answer any questions you may have.
Any questions for Jerry? Is there, oh, Gordon?
I think when we last had our discussion, part of that was a review of all the properties in there because of this particular complexity, and I'm wondering if that has been accomplished as well.
You mean review as a field review, or did you mean just review?
Reviewing all those properties there to see.
Well, yes and no. I'd be the first to admit that they are not perfect in line values of the comparables that he showed. It's something that we can look at a later time, but I did not consider it in this review. I was focusing on the Babb appeal and wanted to get that one correct. But the others are not perfect, and I think there's one there that needs attention.
So you'll be looking at those further?
I will keep the report and keep it as a review as we get into the next cycle in the spring.
Is there a motion from the board on the abatement request 1455?
So moved.
Is there a second?
Second.
Okay, any discussion? Seeing none, all those in favor of the abatement? Okay. Persistence?
I don't know where any more your time.
Thank you. Thank you.
I know. But the upside of this is that, if there's some time spent on this whole thing across the board, the town probably make a lot more money if they, if they balance this out, to see what the highs and lows are. If anything comes from it, I guess.
Okay. Well, thank you for your patience as well.
All right, guys.
Thank you. Anything else, Jerry?
No, that's it.
I think that's it. Awesome. Okay,
Thank you.
thank you very much. Moving on, selectmen's reports. Actually, sorry, we're gonna move to discuss vote to continue waiving fees for metal disposal at the transfer station, Clint.
Let's do it. I don't really know how you figure this. I sat down and I kept going through all the figures. Until we have May's figure, you really can't figure it and be very accurate on it.
Till you have what, Clint?
The figure that we'll have in May, because we don't know what we're gonna take in over the winter, and everything goes from like October, November to May, after the metal's taken in. You do know we've taken in $11,444.40. I tried to figure it, guessing May and June, after the metal was taken out of there, before the cleanup day, I figured we had about 10 ton on the ground. And we probably took in 10 ton during the cleanup day. And then during the summer, we took in around 40 ton. That goes up to actually September, October. But in there is 8 ton for the second cleanup day. So a total of 67.32 ton.
Well, the point is, it's not costing us anything to get rid
No,
of that metal.
right.
And I think that's the issue. I mean, it's, I don't know how many residents have said, you know, I'm not gonna pay to get rid of metal. I can take it up to CIA and get $5 for it. I mean, duh. So,
Well, I think it's working.
Yeah.
In May, I'll have be able to tell you pretty close to what it's gonna cost, or it has cost, what we made.
Okay.
you looking for a
but the-
motion?
Yep.
I make a motion that we cease charging for metal. Does that include white goods or two or not?
That includes white goods except for gas ranges. If we
Okay.
have to take a mercury valve out of there, that has to be taken out.
Out of the thermostat, right?
Yeah.
All right, so,
All right, so we have a motion. Is there a second?
I'll second it.
Is there any discussion?
I didn't hear the motion exactly.
It would be to cease charging for metals brought
Okay.
to the transfer station except for stoves.
Okay, yep, got that.
Okay.
I'm just wondering, are we meeting our costs, all our handling costs and staffing to handle that metal and everything?
Or more, really.
Okay.
As long as the price stays up there, the price that we're being paid for the metal, we're doing fine at the 170 a ton. We're doing great.
Okay, so we're not expected them to have any monies appropriated through taxation to cover any deficit
In the metal part?
in the area of the metal.
No,
So
not
it's,
right now.
so as Dave mentioned, this is a win-win for
Oh, yeah.
the citizen.
Definitely.
Okay.
And if something changes later on where we have to start incurring a cost for the metal, then we could always reevaluate it.
I think as long as it stays up above $120 a ton, we'll be all right. But we have paid, I guess we went down to about $20 a ton at one time. So, I mean, that was costing a little bit, but not bad.
Okay, any other discussion? So all those in favor of the motion? Okay,
Can I have 2 more minutes? Talk about tires? We have quite a pile down there. I have talked to the DEP and they're gonna work with us, but I guess that Randy McMullen from DEP is gonna go to EcoMaine because he's afraid that they're gonna be burning too many tires. And he wants to make sure they know what they're doing, I guess. Basically what he said. And Eric Hamlin he's the one that takes care of the transfer station here, and he said, just don't worry about it. But he said they would recommend, they're recommending to other towns that do what we're doing, have these cleanup days, when people bring in all these tires, that we not charge for tires, and we take in so many a week from different families, and then we could just put them into the hopper after we get this mess cleaned up again down now. That was his suggestion.
so we can put tires in the hopper?
Yeah, we are now.
That's why we're getting rid of them.
Yeah. I mean, EcoMaine really wants them because it's, what is it, gallon and a half of oil in every tire.
Mhm.
So
but we're still charging for tires.
we're still charging. And I know a lot of people are just saying, well, heck with it, I'm gonna keep them out back of the garage and pile them up.
Yeah.
And that,
Which is
put it-
not good either because
That's
of the
the- that's
mosquitoes
the-
and stuff. You know?
DEP said the same thing, he said the same thing in there, but, you're gonna have a lot of fires, you could really have a, problem.
Then you get a lot of stuff thrown in the woods.
Gary?
Does EcoMaine want trailerfuls of tires at this
No,
point in time?
No,
Then he's gonna manage them. He can only put so many into the
Burn
boiler.
pile.
so many times.
he said if the DEP gave us a hard time, that he would take loads and they would take them out to the
Yeah, I mean-
landfill, store them.
That's what he meant.
But he didn't want to do that.
Right,
you know,
because
he's gonna
then,
have to
then
handle
he
it
has to
again.
handle them, so his recommendation is that as long as we can work the pile down, and he even gave us a new number to put in what he would take in a container. Then
Half
he
a
was-
dozen?
I don't know, he's up to 30 or
In an
30 or
MSW?
something like that.
Well, let's back up. For 5 months, we've been putting, average of 43 tires in a load. And then he said to increase it
Yeah.
to 75, and then if they really give us a hard time, we could go to 100. But he didn't want any more than 100.
If they give us a hard time.
Well, I mean,
increase it?
what Kevin's trying to do is, he wants the tires, he doesn't want
Yeah.
us to take them somewhere else.
That's right.
And he wants them enough so the fact that if we do have a push by the DEP, he'll take them and put them at his landfill, they'll
That's
store
right.
them there, and then they'll manage them from that point. He'd rather not do that, because that's a cost to all of us, because it's in the operating cost of Eco Maine. So, as long as we can continue to show that we've got a positive flow of product and the pile's going down, I think that's our stance with the DEP. The fact of the matter is that we had 2 cleanup days. Those tires were sitting up on a ridge at somebody's house for years.
Yeah.
So, and they
Hopefully,
didn't,
we won't see as many
they didn't even know
future
that.
cleanups.
the DEP didn't even know
So do you think, Clint, we could address this cost of tires at no cost, maybe in June, before or something?
I think maybe it should go to the committee and they can
We had the
discuss what they wanna do and.
that. We had the discussion at the committee level and decided to vote was to not do anything yet, right? Because there's the other issue of tires that come in that have wheels in them and everything else, so.
Well, Kevin did tell me he'd like to have all the wheels too.
Well, you like the metal,
Say
right?
that's a metal.
He wants the metal.
Yeah.
So,
But we have so far, in the 5 months, we've shipped up till now, 2,159 tires.
so in the next few months, it'll be done.
Has the pile gone down at all?
Yeah, it really has. I can see it, but still quite a charge down. It's a good, 4,000 or 5,000 tires.
What I find interesting is that no matter where you buy tires today, you pay a disposal fee, right?
Right.
And they're supposed to keep those tires. And yet we continue to see, well, and I understand this was a unique situation where they'd been stored for years, but
But Eric
Just
just say
amazing.
that some towns have tried this, and if you're gonna, we're taking around 1,000 tires each cleanup day. Some ways, 1,000, 1,500, something like that. We'd be better off to take them and take 10 or 15 or 20 to a load after we get the mess taken care of and just get rid of them.
Yeah.
And we wouldn't have it all at once.
Yeah, it's a liability for us to have 5,000 tires down there.
Yeah.
Okay, anything else, Clint?
No, well, I did figure all the recycling rates for Bassering Lawns, if you want that.
Might as well while you're here.
sure.
Okay, September, this is taking the tires out and readjusting everything. 18.81% for September. October is 21.41%. And then November went down to 17.98%.
And
a lot of
December will be
fluctuation.
up, because
Will be up,
it's timing.
Yeah.
It's all about timing of when the loads go.
that's right.
Okay.
Okay?
All right, thank
Thank
you,
you.
Clint.
Thank you.
Now moving on, selectmen reports. Gordon?
The thing I have is, on behalf of the board, I'd like to extend once again our condolences to the Woodson family, because Clint Woodson has passed away now. I know shortly, several meetings ago, I had indicated that his wife had passed. Now Clinton has passed, and so our wishes go out to the family member.
David?
Met with the 2020 committee last night. They're doing a fantastic job. They're trying to finalize everything, get reports done on different sections, and still have a lot of work to do, but I think we'll be done in time for June.
Dennis?
Kick off the EDC tomorrow night, whether all the members are there or not. And I think that there are some folks kind of waiting in the wings to see what's gonna happen there, and they'll opt to join, so, I think we need to just get moving with it, so. That's tomorrow night, 6:30 in this room, so.
Town Administrator's Report. Gary?
Thank you, Madam Chair. Several things to talk about here. Did you do a reminder about Christmas and New Year's week?
No.
Before we started? Okay. Just like to, Christina, are we on? Okay, thank you. Had some tough technical difficulties tonight. We apologize for that. Dave Lowe is out of town, and Christina's done a bang-up job of trying to sit in there and push all the buttons and make things work. So thanks to her for that. A reminder to the public that during the Christmas and New Year's weeks, the only days that Town Hall will be open, because of the way the holiday sits, is Thursday and Friday of each of those 2 weeks. We still have openings for Budget Committee and Economic Development Committee members, as Dennis said. The Budget Committee is certainly a much more short-lived commitment, a few months during the winter, getting ready for town meeting. The Economic Development Committee needs people that would like to think 5, 10, 15, 20 years out of what you want Waterboro to look like. Switching over to Public Works, Doug Foglio was in here just a little while ago, and the final piece of cement in the overpriced erector set over there was installed today. I think they ran out of daylight beforehand, but they got it in. So look for that road to probably be open this weekend with some reclaimed pavement on top since the pavement plan is closed down. But they'll be cleaning that up over the next couple of days. Timber sales is going to be over $30,000 once we've already taken in $27,000 and change. I found out today, from talking to Brian Reeder, there's a $3,261 check in the mail, and then one other final check will be about $1,000. So a little bit more taken off the property there than the initial estimate. Had an interesting call from a gentleman who lives on Blueberry Road that wants to buy one of our tiny abutter parcels, so I'll be following up with him, and hopefully we'll sell it to him fairly soon. I had a trip up to Augusta to meet with the Maine State Retirement folks, and since we do need a town meeting vote to join that, if we do indeed decide to join that as a community, we could do that as of July 1st for Maine State Retirement for our employees here, since we do not have that now. As most of you know, the Sewell Company has been working with the 2020 Committee for the Comprehensive Plan Update. And I asked them, since they were fairly deeply involved in looking at sewer possibilities throughout the town, I asked them to just give me a quote, just from their company only, just unofficial, of what a study would look like if they were to look at land application sewer as well as subsurface, since we don't have a river here that we can put treated sewer into. So they did that, and it was just shy of $25,000, which didn't surprise me much for a study like that. I really did that to get a placeholder in the budget discussions. I think the 2020 committee is more interested in increasing the water supply at the moment than really looking hard at sewer, and that's fine. It may take a few years before we decide to go down the sewer route, but I'd like to get us as prepared as possible with information as we go down that road. 2020 committee, as David and I heard last night, they've asked the selectmen and myself to write a governance chapter, so I've offered to draft that up for you folks for your review, and you can take out your red pens and add to it, and you'll have to add to it because knowing me, I'll be excessively brief in that, and you folks have a lot more history with the community than I do. I think I found a good person to do our customer service workshop here. She used to work in the hotel industry, and she works for MMA now. And I couldn't believe it, but the only thing we have to do is pay her gas. Or if it snows, we'll put her up in a motel room. So the price is very reasonable. She's done it quite a few times for MMA. We'll just pare it down to, I would say, 3 to 4 hours and do it in this room.
She doesn't drive a Hummer, does she?
No. But that day she can if she wants to. I don't care. Because we're members, that's why the cost wasn't higher. And they don't usually do this for individual town halls, but she said, if I can fit it into my schedule, I'll do it for you. And that's very good because I really respect her. I've seen her in action with a variety of the training sessions at MMA, and I respect what she knows. On a generic level, Julie is out at an advanced Excel class today and tomorrow. Christina will be out enjoying some company with family that's been away for a while for the rest of this week, Thursday and Friday, sorry. And I'm going to have a wonderful medical procedure, some oral surgery on Thursday, and hopefully be back at work on Friday and be there Friday night. So don't want to miss the meatballs.
Right.
So that's it from me. Thank you.
You don't want to miss that.
Okay, moving on to new business, review timber harvest. Gary?
Yeah, I guess I just did that. They're all done. and 2 other checks are in the mail, and it'll be over $30,000 if you haven't walked the property. There's a little bit of snow out there now. I really like what they did because they pulled all the tops out and there are no slash piles on the property. And that all went into chips and made us maybe $1 a ton, but it made us a little revenue and just made it look a whole lot nicer. The nicest wood in the whole property is still standing on the trees. They got rid of the severely fired, scarred timber on the stuff that needed to be taken out to allow some space in there for future growth. So hopefully in another 20 years, you'll do this again and the quality of the wood will be better than this time around. So I thought they did a nice job.
You'll be amazed at how much more growth we'll have.
Yeah.
Oh, yeah.
They also helped us out by taking some of the trees at the top of the gravel pit. We need to stump that out probably in the spring so that we can get access to more gravel. And that was a nice benefit to have them right in there.
Okay. Moving on, discuss plans for employee volunteer holiday dinner. So we have this on Friday night at the fire station, starting at 5 o'clock. John?
Okay, in the past, I've done most of the purchasing and, on Thursday and then pretty much cooked on Friday. I've talked with Leo Bennett, and at Lakeside. He in the past has done he's given us a lot, and he's doing it again this year. And I just wanted to tell him, I said, you know, when we come over here and talk to you, I really appreciate everything you can do. I just don't want you to think that we expect it, you know. And he said, no, I'm very happy to help out here. So I'm going to be getting a lot of the bread, the sauce supplies, the meat, etc. from Leo, and then I'll be going to Hannaford to get the other stuff to fill in the things that Leo doesn't have for us, and it'll start cooking on Friday. We're going to have some table prizes, poinsettias, which we've done in the past, and Tammy Joe.
Dessert?
Yeah, are you
I'll
in
take care
it?
of
Are you in it?
I'll take care of dessert.
Okay, so I think we're looking good. I'm gonna need to get a card for Hannaford's too. Okay. Do you trust me with it?
A credit card?
Yeah.
To buy things with? Sure.
Can I have the card, Dad, please? So, Christina, are you taking care of getting the table stuff?
We have everything we need for like little favors for people to take something home, and all the paper goods, and I've got it kind of all ready, so someone just needs to set the tables and it's all over there. And then to go along with the poinsettias, I found some little evergreen trees. They're real live trees in pots, so I got 5 of those too for the drawings.
Okay, and we have the lotto tickets are with the paper
Yeah,
goods?
they're all in the boxes. The stuff's all over the box.
Okay. So we need to make sure that we've got us there to get tables set up, the paper goods out and whatnot. So it starts at 5. We should plan on being there by 4.
You should, yeah. Yep, that'll get all the tables set up and tablecloths on and the stuff on the tables and all the things plugged in, warming plates and stuff like that.
Okay.
Yeah.
What can be done earlier in the day, John? Because I have some calling hours to go to for a death of a former trooper, Jim Monroe. I don't know if you know Jim. Yeah, his calling hours are Friday night.
Yeah,
So at the same time that I'm supposed to be there, and then I've got to rush off after to my family's Christmas party.
So you're not going to be there Friday night?
No, I'm going to be there, but I just want to know if there's something I can do earlier. Then I can go and do what I got to do there, and then head over to the fire department again, and then because I'm going to have to leave there to go to another.
So it's the front end that you're not less available than the back end. than after,
Well, what, you know, what,
you're less available at 5 o'clock than you are at 7 o'clock.
yes.
Because what
Exactly.
I'm going for is we'll get you doing dishes. Pots and pans.
David, what time is 4 o'clock gonna work for you?
Well, I am a bit of a conundrum because I have unexpectedly, because of illness at the academy, weekend duty this weekend. But I will supply my usual to make sure it's there. If I can get out in time, I'll come down and help you do dishes, Gordon, but
Well, there hasn't been a firm commitment.
We have a great time doing
Yeah.
dishes, David.
Dennis, how
No,
about you?
I'm all set.
You gonna be there?
Yeah, we'll be there.
All right.
Might have my granddaughter with me, but we'll
Does she wash dishes?
Put it to
she's
work.
only 5, so
We
I
can,
don't think
we can
she's-
put her to work. All right.
Sharon washes dishes though.
bring the dog, he can take care
Yeah,
of
the
that.
dog will clean everything.
So, why don't we use
Put a
paper
dish rag
plates?
on his tail. You can dry. All right. Good. So I think
We
we're
can use
we're all
paper
set.
plates, I think.
Discuss the audit. Gary.
You have a partial audit that's in front of you, and we got that by email today. Also, just received that today. That's the first few pages. So we're still in communications with the firm to see when they're actually going to finish the document.
I sent you an email just before I headed up here tonight, but I talked to Ron twice today.
Yep.
He's apologetic for having the delay. Feels that most of that is on his part. I did query him to see if part of it was us not being ready, but he did say Chris got started late, but and he had hoped to have it done in here tonight, but you should see it in the morning.
Okay.
And that'll be the final draft, basically, of the draft, and then we'll have to go over it, and then.
Yeah.
So I mentioned him that we would be meeting again next week, and intent would be to review it, and if there's any issues, then possibly accept it next Tuesday night, so. But I spoke to him, I guess, second time was 4:15 today.
Did he give you a general barometer indicating on
He
the
believes,
overall financial health?
he believes the fund balance will go up.
That's all we need to know.
From the previous audit.
Yes.
Okay. Good. That's the end of the new business. We have nothing under old business. Other would entertain a motion to sign the minutes of the November 26th regular meeting.
So moved.
Second?
All those in favor? Okay. Pending decisions, we have discussed making policy changes relative to the use of social media. We have that scheduled for next
Scheduled
week.
for the 17th.
So that's
yeah.
gonna work, okay. Town charter change to establish public works department, still working on that, I understand. The week's action list. Jerry's gonna continue to look at, some property evaluations. Agenda items for next week. So far, we'll have the social media policy. Hopefully, we'll have the audit.
Presentation of the Christmas,
The lights.
yeah.
Anything else? Okay. So items needing signature would be the minutes of the November 26th regular meeting and the abatement. Reminders, Wednesday, December 11th from 9 to 4 is the York County Community Action Fuel Assistance appointment here at the Old Town Hall. You must have an appointment, and you need to call 324-5762 to schedule that. Senator King's office is going to be having constituent hours here from 10 to noon tomorrow, and the Road Review Committee is meeting tomorrow night at 6 p.m. At 6:30 p.m. tomorrow night is the first meeting of the Economic Development Committee. Friday, December 13th from 5 to 7 is the Employee Volunteer Holiday Dinner. Saturday, December 14th at 8 a.m., there is a planning board site walk at the Carpenter Estate on Clark's Bridge Road. At 8:30 a.m. is a cribbage tournament. Tuesday, December 17th at 6 p.m. is a Selectmen's meeting. The 18th at 7 p.m. is a planning board meeting. The 23rd will be the Transfer Station Recycling Committee. On the 24th and the 25th, the town offices will be closed for the Christmas holiday. Saturday, December 28th at 8:30 a.m. is a cribbage tournament. And then on Tuesday, December 31st and Wednesday, January 1st, town offices will be closed for the New Year's holiday.
Do you want to, that includes the transfer station, is that right? How's that gonna work?
That would be my recommendation, that we start doing that.
I thought
We did vote.
that?
Yeah, we voted on that
So that
last.
wasn't just a one-time, when we voted on that last, you tended to endorse doing that when town hall was closed, transfer station is closed.
Well, we voted to do it for Christmas.
Yeah. and
Specifically for
I would think we'd do
Christmas.
it New Year's.
Okay, that's fine. Okay with that?
I just, you know,
And I think the intent was we need to look at the personnel
Yeah,
policy
yes,
and incorporate that. So with that, I would entertain a motion to adjourn.
so moved.
Second.
All those in favor? Thank you and good night.